Hi, everyone. Good afternoon, and welcome to the Alliance for Home Health Quality and Innovation webinar on the AHHQI Home Health Chartbook 2020 edition with our guest from Avalere. My name is Jennifer Schiller, and I'm the Executive Director of the Alliance. By way of background on the Alliance is a 501c3 research foundation. The Alliance's mission is to lead and support research and education on the value home health care can offer to patients in the evolving U.S. healthcare system. Working with researchers, key experts, thought leaders, and providers across the spectrum of care, we strive to foster solutions that will improve healthcare at home through quality and innovation. Today's webinar will serve as an overview for the Chartbook, how to use it, key data from this year's edition, and more. The Home Health Chartbook is an annual compilation of data and statistics compiled by Avalere and commissioned by the Alliance, which offers a glimpse of home health patients, the home health workforce, organizational trends, and the economic contribution of home health agencies. I would like to thank the sponsor of the 2020 Chartbook, the National Association for Home Care and Hospice. NAC is a proud supporter and user of the Chartbook. NAC represents the nation's 33,000 home care and hospice providers, along with the more than 2 million nurses, therapists, and aides they employ. These caregivers provide vital services to Americans who are aged, disabled, and ill. Some 12 million patients depend on home care and hospice providers who depend on NAC for the best in advocacy, education, and information. NAC is a nonprofit organization that helps its members maintain the highest standards of care. To learn more, visit NAHC.org. Now I would like to welcome today's speaker, Heather Flynn. Heather is a consultant with Avalere. She supports clients on developments and trends in healthcare delivery and payment innovation. She provides research and analytics on payment and legislative reforms, delivery models, and industry trends to assist clients in identifying market opportunities and meeting strategic goals. Prior to her current role at Avalere, Heather advised clients on Avalere's business intelligence tool, the Vantage Care Positioning System, where she helped clients gain insight into provider performance and market trends through comprehensive Medicare claims analysis. Heather has an MBA and an MHA from Marymount University and a BS in Biological Sciences from Virginia Tech. A few housekeeping notes before we get started. Heather will speak for about 40 minutes, and we will leave the remainder of the time open for questions. All lines will be muted throughout, and you can submit questions through the questions box in the control panel. Within a week of the webinar, slides and a replay of the webinar will be posted to the Chartbook section of the Alliance's website. With that, I'd like to turn it over to Heather.
Thank you so much, Jen, and hi, everyone. So excited to be here with you today and to go through the contents of the Chartbook. As I mentioned, I'll talk for about 40 minutes and then happy to leave some time for question and answers. So to orient you with the Chartbook, the purpose of this is really to walk you through the research that Avalere has conducted on behalf of AHHQI, and the Chartbook does a few things. We look to identify the types of beneficiaries that are using home health, so in terms of their clinical profiles and their demographics, analyze how Medicare beneficiaries are using home health services, and then take a look at the home health industry trends at large and how they're changing over time. So we'll go through a bunch of sections that are currently in the Chartbook, but we will only touch on example graphs from each section. If you go on AHHQI's website, you can access the full Chartbook, which is much larger. Today, we're going to go through about 20 slides, while the full Chartbook houses, I think, we have between 60 and 70. So definitely just looking at a sample. The other great thing about the Chartbook is Avalere has done this for many years in partnership with AHHQI. So on their website, you can find all of the historical Chartbooks, which allows you to look at this data over time. We've purposely kept the format fairly consistent, so you can easily pull up multiple Chartbooks, look at them side by side, and see how some of this data has changed over time. In terms of data sources, the Chartbook leverages a few different sources. So that includes the MCBS, or the Survey of Medicare Beneficiaries, both in the fee-for-service and MA space. We rely really heavily on our Medicare claims database, but we also leverage some other publicly available sources. So you'll note throughout the Chartbook that the years of data change a little bit based on when these different data sources are updated, but every chart will have a year, so you know exactly what you're looking at. The last thing I will note in terms of years is none of the data currently in this chart book reflects 2020 data. The most recent is going to be 2019. So we won't yet see the impacts of the COVID-19 pandemic as it relates to the 2020 chart book. But as Jen and I have discussed, it'll be very interesting to see next year's chart book as those data sets start to update and materialize, and we really see the impact of the public health emergency on home health and healthcare more broadly. So with that, we can go to the next slide, and I'll orient you to the different sections of the chart book. There are 6 total sections. Again, we'll walk through example charts in each. So we have demographics, some clinical information, a look at the post-care market overall, and then sections 4 and 5, we really lift up to say, what is the home health industry doing at large? And then the ever important outcomes in section 6. So with that, we'll start with section 1 on the next slide, looking at demographics. So this section broadly is going to look at things like age, gender, race, income, chronic conditions, and other demographics for home health users compared to other groups. So compared to all Medicare beneficiaries broadly, as well as to skilled nursing users. So this is by far the largest section in the chart book, so a lot here, but I've selected a few graphs to orient you to what you might expect. So on the next slide, on slide 4 here, you will see this is the age distribution. So we're looking here at home health users compared to all Medicare beneficiaries. And what this really points out, which probably doesn't surprise any of you, is that home health users tend to be much older than the broader Medicare beneficiaries. So for age 85 plus here, you see all the way on the right-hand side, about 24.5% of home health users fall over the age of 85, while in the broader Medicare population, that represents only about 11%. Next, on slide 5, we really wanted to look at Medicare Advantage. Given the growth of Medicare Advantage over time, we want to track the percentage of both MA versus fee-for-service beneficiaries that utilize home health. This is a relatively new chart. I believe we added it in the 2018 chart book. But since then, we have seen growth in home health utilization, both across fee-for-service and MA. So to give you a sense, I believe in the 2015 data, we saw about 5.76% of fee-for-service beneficiaries use home health. Now we're up to what you see here at 7.7%. And on the MA side, in 2015, we had about 5.2% of MA beneficiaries utilizing home health, and here we're up to 7.6%. But interesting to see how the fee-for-service and MA beneficiaries remain fairly close in what percentage is utilizing home health versus the non-home health users. Next, on slide 6, we're going to look at chronic conditions. So I always find this chart interesting when we compare the average number of chronic conditions for beneficiaries that are home health users versus, again, that general Medicare population. So here on the left-hand side, you see about 47.3% of home health users have 5 or more chronic conditions, where if you look at all Medicare beneficiaries broadly, that's only about 22%, where almost 41% of Medicare beneficiaries fall in the 0 to 2 chronic condition category. So really just pointing out that home health users tend to have far more chronic conditions. They tend to be more acute versus when you look at the Medicare population broadly. Further driving home this point on slide 7, here we look at serious mental illness, so defined as severe depression or other disorders, including bipolar disorder, psychosis, or schizophrenia. We see, again, a disproportionate amount of home health users have serious mental illness when you compare it to the broader population, at about 10 percentage points differences when we look at 38.3% of home health users have a serious mental illness, while in the broader population, we're looking at just under 29%. We'll see a little bit later, too, that this has increased over time. This data is reflective as of 2017, but when we start to trend backwards, we see the home health users increasing in acuity over time. Next, on slide 8, I think this is a great summary slide. So we look at some of these key metrics and key demographics all in one place, again, for the Medicare population, broadly versus those in Medicare that are utilizing home health. So here, if we look at those with the 3 or more chronic conditions or 2 or more activities of daily living or those ADL limitations, we see that big differential here. When we look at 2 or more ADL limitations, we're looking at double the amount. So about 10% of Medicare beneficiaries require assistance with 2 or more activities of daily living, where little under 28% of home health users require the same level of care. If we also look at the income level here at the bottom, we'll see about 57%, over half of Medicare home health users fell under 200% of the federal poverty line, where in the Medicare population broadly, that fell at about 43.6%. So again, all of these charts are just pointing to that home health users are older, they have more acute and complex conditions, they seem to have lower incomes, so just really accentuating the important role of that home health plays in the continuum and the unique population they serve within the broader Medicare population. To give you a sense, as I mentioned before, for how this changed over time, here on slide 9, we look at the demographic trend, again, but over time. So here we're looking at 2011 to 2017. So this is the similar information, but now we're adding that continuum over time. A few things I find interesting here. So when we look over these 6 years, we see that the percent of home health users with lower incomes has actually declined a little bit. So we were at 64.5% under the 200 poverty line level in 2011, and now 2017 we're at that 57% we just talked about. See the similar trend if you look at those that have incomes under 100% of the federal poverty line. We see that chronic conditions in the ADLs, these top 2 rows here, have remained fairly consistent since 2011, but again, you see a slight decline. On the flip side, as I mentioned earlier, when we look at the bottom of the slide here in terms of dual eligibles and those with serious mental illness, we see an increase in this over time. So for dual eligibles, we went from a little under 30% to a little over 30% in 2017. But for serious mental illness, we jumped all the way from 26.3% of home health users having a serious mental illness in 2011, all the way to 38.3% in 2017. So again, the chart book will allow you to trend all of these over time. We try to give you a little bit of a flavor for how things have trended in some of these graphics, but given how long we've done the chart book, you have the ability to look at any of these metrics over time. With that, we'll flip to section 2. So in section 2, you're going to look more at the clinical profile. So we just kind of covered demographics, and there is a lot in section 1 if you access the full chart book. Section 2, we're going to look at things like hospital DRGs and ICD-10 diagnoses. There is a lot of state-by-state information in section 2 in the full chart book. We won't go over any state-by-state information today, but know that it is available in the full chart book if you're interested. So section 2, for example, has the percent of users with 3 or more chronic conditions broken out by state. That's included in section 2 if you access the full chart book. So also know that not only do you have the ability to trend information over time, but you also have the ability to look at your specific state or see how the states compare to each other if you access the full chart book. So on slide 11, this is kind of the highest level in section 2 in terms of the clinical profile of home health users, those discharged directly from the hospital to a home health agency. What are the most common DRGs we see for those patients? So again, keep in mind that this is hospital discharges only, so just that part A, the subset of the home health population. But interesting to see also how this has evolved over time. And one thing Jen and I have noted is that over the past few years, we've seen a switch in septicemia and major joint, hip and knee. So these top 2 DRGs here, for several years, major hip and knee was number 1 consistently, and now we kind of see that switch where septicemia has risen to the top of the list in terms of the most common Part A home health claim. But I will say that the top 3, so septicemia, major joint heart failure, have been fairly consistent since the inception of the chart book. So we do still see some stability here in the most common maybe just some shifting in the particular order. The other thing I find interesting here is when you look at all 20 of these together, this represents about 38% of the total, all of the Part A claims. So 20 DRGs represent 38% of the claims. Shows you how concentrated these DRGs are in terms of which ones are going to home health. More specifically, if we look at the top three, so again, septicemia, major hip and knee, and heart failure, these represent about 15% of all of those Part A claims. So fairly concentrated here at the top, but when you're looking at the top 20 for Part A, you're looking at a fair share of the Part A claims that go to home health in general. So we'll whiz right by Section 2 and move on to Section 3. Here we're doing a post-acute care market overview. So we're going to look a little bit more broadly to say, how does home health compare to other post-acute care settings in terms of discharges, admissions, now and over time? How is the broader market using post-acute care? Again, there's more information here in the state level, but we'll go through a few to orient you to the type of information you'll find in Section 3. So on the next slide, we are looking here at the inpatient discharges following an inpatient hospital stay. So again, this is just following an inpatient hospital stay, where are those patients going? So within the 36% of those beneficiaries that are going to a post-acute care setting, you see that breakout then here on the right-hand side. About 13% of those are going to home health, 19% going to skilled nursing, 3% to inpatient rehab, and about 1% to those long-term acute care hospitals. On slide 14, on the next slide, we'll see how this has changed over time. So again, at a national level, the number at the top will recognize how many discharges were sent from an inpatient hospital to a post-acute care. So you'll see that this has decreased somewhat over time since 2014 in terms of the total discharges from an inpatient hospital going to a post-acute care setting. However, I will note that, this decrease, we've seen this for several years, is likely driven by a reduction in the number of hospitalizations nationally over time, rather than a reduction in those specifically going to post-acute care. And then within these bars for each year, you can see the distribution of where patients are going. By and large, this actually has remained fairly consistent over time. So you see about teetering right around high 50s percentage at 58 in 2019 going home or to the community setting, while right around 20%, 19% are going to skilled nursing, and between 13 and 14% going to home health. So over the past 6 years, we've seen this remain pretty consistent. Again, this might be different at the state level. So this is another thing that if you want to go into the full chart book, would be really interesting to see what is the variation on the state level. We definitely do see more variation at the state level in terms of utilization generally, and where discharges go, but then also how those discharges by state have changed over time. So another great thing to use the full chart book for. And then next, on the next slide, I think, we talk a lot about these hospital discharges, but now if we look at not only, the hospital discharges are one small admission source for home health. So let's lift up and say, where else are these home health admissions coming from? You will see here about 55.7% of home health admissions came from the community setting in 2019. And over time, we've actually seen that grown a little bit. So in 2017, we were at about, I think, right under 54%, 53.7% of home health admissions or home health episodes came from the community setting. Obviously, now we're up here at a little under 56%. So seeing those community referrals grow over time as we continue to do this chart book. So moving on, sections 4 and 5, we're actually going to combine here. They're pretty related and similar, and they're also smaller sections within the chart book. So these look more broadly at the home health industry at large and how home health influences the industry. So in section 4, the organizational trends, we'll look at things like the number of home health agencies over time and how that's changed, the number of episodes we see over time, number of visits per episode, both in Part A and Part B, and then also some state information on the number of beneficiaries utilizing home health. So again, some great state-by-state information in Section 4. In Section 5, we look at the impact of home health on employment, labor, and output. I will note that most of Section 5 is on a state-by-state basis. So we won't touch too much on Section 5 here, but know that, again, if you're looking for state-specific information, there's some great information in Section 5. So here we are looking at the Part A and Part B episodes over time. You'll see this is a really long trend. We're going to go all the way back to 2006. So these are in millions, of course. So as we know, we see, and as we see here kind of play out, you see from 2006 to 2010, there was a big growth in home health, and we saw the total number of home health episodes increase, and then things have somewhat leveled off. We've seen a little bit of decreases in recent years. You'll see a lot of these decreases if you look at the lighter blue, which is those Part B community episodes versus the Part A hospital episodes in darker blue. We see that these slight decreases in recent years are largely due to that Part A hospital side. So for instance, if we look back to 2013, here in the center, we'll see for Part A, we were at about 2.45 million episodes. Now in 2019, we're down to just over 2 million. So you'll see, as we talked about previously, kind of the trend in hospital volume overall trickling down to the post-acute care settings. We see a decrease in Part A episodes overall, which drives this slight decline in total number of episodes. But again, when we look all the way back to 2016, fairly consistent when you consider how long we're looking over time. To look at that a little bit more in detail here on the next slide, we are looking at the number of visits per episode. So in each episode, how many home health visits are actually occurring? And we can look at this in a few different ways. We look at it at a global level for all claims, and then we can also look at this again in that Part A versus Part B lens. So if we look all the way back to 2017, you'll see there's quite a lot of variation in the Part B side, where the Part A side has remained fairly consistent. Historically, as you'll see when we look at 2008, 2007, 2009, those first few years on this chart here, there tended to be more visits per episode on the Part B side. As you get to more recent years, things have started to shift and becoming more even. That differential between the Part A and Part B number of, again, visits per episode is lessening. So there's different reasons you can speculate for this, perhaps because those utilizing home health are becoming more complex in general. So we see, a little bit of an evening out between the Part A and the Part B home health patients. The care that's going to be required is becoming more similar between hospital discharges and community referrals. So things are starting to even out a little bit. And then in 2019, we're landing here at about 18 visits per episode for Part A, about 14 for Part B, to bring us to an overall average of about 14.9, right under 15. So here this is how we'll touch really lightly on the economic contribution of the home health agencies. This is one of the charts that we saw in Section 5. Again, looking at the impact of home health kind of on the national scale in terms of the healthcare industry at large. This is looking at the impact of home health on jobs. Again, we're going actually all the way back to 2003. I find it really interesting that we see such a steady and consistent increase in home health jobs since 2003. So, we hear a lot. This can point to the pressures on labor and staffing in the home health industry that we've heard about for quite a few years, and the need for these skilled staff because the demand and the growth in the home health industry is just so exponential. And this chart, I think, really points to it. So this is the kind of information you'll find in Section 5. Again, a lot of the information in this section is statewide. So looking at economic impact, we also look at jobs on a state-by-state basis. So I think it's really interesting to see the differential between states, but I think this summarizes really well to show how much the home health industry is growing and how consistently we haven't seen one decline in the number of home health jobs since 2003. So moving right along to section 6, we're going to look at outcomes. So obviously here, this looks at what is the actual impact of home health on caring for these patients, the quality of care. Of course, we talk a lot about readmission rates, both by condition as well as for the home health industry at large compared to other settings. A large portion of section 6 is also on quality measures, so the home health compare measures. We look at those nationally and how they've trended over time in terms of the national average for home health. We also look at those state by state. So there's a select few home health compare measures that we will go state by state and show their average rating. So again, a lot of state information here, a lot of home health compare. Today we'll touch on some of the readmission information, but know that if you're interested in quality measures, we do touch on that as well. So at a high level, if we look at what types of patients are getting readmitted from home health and how that compares to those patients that are readmitted from the skilled nursing side, this is a great graphic to show how do those two settings compare and what types of patients are being readmitted. So again, we are looking at those patients that were discharged from the hospital to either home health care or skilled nursing care, and then were readmitted within 30 days of discharge. So again, this is just the hospital discharges. We're not looking at those community-based patients here. But at a high level, I think we look at the most commonly readmitted DRGs for home health at the top. So we're looking at renal failure, kidney diagnosis, and heart failure. And then we draw the comparison to skilled nursing. And we see that a lot of these fall somewhat in the same range. We have renal failure where home health is a little bit higher than skilled nursing. But interestingly, then when we go to the bottom here and look at the ever popular major hip and knee replacements, we see that the home health readmission rate is lower than the SNF at about 4.39% compared to 7.75% for major joint. Similarly, if we stay on the orthopedics train and look at hip and femur, the second row from the bottom, we see home health at about 6% compared to skilled nursing at about 10.5%. What really surprised me, I'll say more than anything about this graphic though, was the fact that the average rate across all MSDRGs, so not just looking at the top 20, but looking at all of them combined, all DRGs, was even for home health and skilled nursing. Generally, in the past years, we've seen that the skilled nursing rate overall was a little bit higher than the home health rate, but really interesting to see them completely even. So that was a little bit of a shift from our previous chart books, but again, the average readmission rate total has always fallen somewhat similarly for home health and skilled nursing, but interesting to see the breakout of how, if you go on a condition by condition basis, we see quite a differential in some of these between home health and skilled nursing. And the fact that major joint and hip and knee are falling here at the bottom at 4% and 6%, I think is a testament to, the focus of the industry recently on orthopedics and specifically major joint. So on that note, we will take a little bit of a deeper look at major joint on the next slide. So here this in the next slide, we will look at both the readmission rates for major hip and joint. So here we are looking at 469. On the next slide, we'll look at 470. Again, we're looking over time here. So this is from 2009 to 2019, so over the last 10 years. This one specifically is for 469. So here we're looking at those with a major complication or comorbidity. We see that home health has the lowest readmission rate, landing in 2019 at 9.6%. When we compare to skilled nursing and inpatient rehab, you will see since 2016, we saw inpatient rehab and skilled nursing come much closer than they have been historically. Historically, we saw the skilled nursing rate a few points higher than the inpatient rehab. And then in 2018, we actually saw them almost completely meet in 2018 and just a few tenths of a percentage point off. And then in 2019, again, a little bit of a differential there at 16 and 15.8%, but still both pretty notably higher than the home health rate at 9.6. And the rate for home health has been fairly stable over time, with 2011 being the height, but teetering right around 9.5%, sometimes dropping down as low as 8.5%. When we go to the next slide, this will be the final graphic we'll go over today. Now we're looking at DRG 470, so switching gears to those without complications or comorbidities, you'll see largely the readmission rates are much lower, where before we were talking about in the vein of 9 to 16%, 17%. Here, of course, without complications, we're talking about 4, 7, 8% readmission rates. Home health remaining at the lowest, down here at 4.4%. Very, very consistent over time on DRG 470. And we have inpatient rehab at the highest, a little bit differently than we see in DRG 469, remaining consistently slightly above skilled nursing facilities throughout time. One thing I will note for all of the readmission rates that we just went through, these are not risk adjusted. So throughout the chart book, we show readmission rates. We do not risk adjust the readmission rates in the chart book, but so they're not changed based on the acuity or types of patients, the different types of patients these settings might see. But I think directionally it gives you a good sense for how things are landing, and the different care that these settings provide and how they compare. So with that, I will wrap up a little bit early and leave some time for Q&A.
Thank you so much, Heather. And as a reminder, if you do have a question, please submit it through the chat box to me as the organizer, and I will present it to Heather. In the meantime, while we're waiting for some questions to come through, Heather, I have a couple that came to me while you were talking.
Mm-hmm.
The first being, we talked a little bit about it, but I don't know if there are any trends in home health that you noticed that continued throughout the 2020 edition. We saw jobs, we saw, I know we talked about severe mental illness. I didn't know if there are any others that may not have been year over year in this chart book, but that you've seen having worked on it for a while.
Yeah, I think you hit on the two main ones that I would note. I think and none of the trends are surprising per se. I think we see a lot of the trends that have continued, just again, continue on the same track over the last few years, but certainly the growth in home health generally, so the jobs, the number of episodes, the acuity continues to be surprising. It does interest me how, some acuity measures tend to take off more than others. You mentioned serious mental illness. We saw that serious mental illness increased pretty drastically over the last few years, where other things have remained somewhat consistent, such as chronic conditions and ADLs. But I think by and large, you still see that increase in acuity and the growth in the industry. I think what was interesting to me, and I believe, Jen, we might have even touched on in one of our previous discussions, is we see the big increase in home health jobs, yet when we look at, which isn't a chart we went over today, but when you look at the number of agencies, you see a slight dip. So kind of inverse there, but I think, that could be due to consolidation and joining forces of different agencies, not necessarily a reduction in utilization of home health or the growth of the industry at large. So another thing to keep in mind, but that was another interesting thing I found was, we see the growth in everything else, but the slight dip in number of agencies.
And I think you and I talked to previously about sort of we don't have a ton of historical data for Medicare Advantage, but I think, and we did talk about the Medicare Advantage slide in this presentation, but that we're seeing the utilization of home health amongst MA come up to that same rate that it is in fee for service, whereas there was a differential a few years ago.
Yeah, and I think it'll be really interesting to see to that point as the years go on how MA plays in the home health space, because I think not only are we seeing an increase in Medicare Advantage across the board, but with the expanded supplemental benefits, we're starting to see more of these innovative partnerships between home health agencies and MA plans, which I think can also play a role in the increasing acuity and the fact that home health agencies are starting to care for more acute patients. So I think, to your point, as years go on, we will start to see the increasing role of MA and how that factors into these other shifts that we're seeing, mainly volumes and things like acuity.
And while we're waiting for another question, are there any surprises from this year's edition?
There was nothing that struck me as a shift in trend. There was nothing that suddenly started to go the other direction. But I do think, I say that with this edition of the chart book where we're looking through 2019. I think, as we've talked about, I would expect next year when we start to integrate 2020 data, we will have quite a few outliers and quite a few things that might be shocking. But for now, I think this is the calm and the consistency of trends that we've been seeing for a few years. But I will expect that 2020 data is going to look quite different.
Yeah, and I think going through it, you hit on it. There's a lot of consistency in the trends that we've seen. Maybe a year outlier in the past, and we obviously can't predict what it'll look like next year going forward. But there has been the year-over-year data really does show a lot of consistency, I think.
And I will add, I think for the next edition of the chart book and even years going on, I think not only is it going to be interesting to see how the pandemic and COVID-19 plays out in the data, but also Medicare Advantage and the partnerships, as I mentioned. But we also see the home infusion therapy benefit, in-home dialysis is gaining traction. There's so much going on in the home health space that wasn't going on 2 years ago, that I think there's a lot of interesting data to come, I think.
And PDGM as well.
Yes, just to name a few.
Well, I don't see any questions, but I just want to remind everyone that if you do have any questions, you're welcome to reach out to me after the webinar, and I will work with Heather to try and get anything that you have answered. So with that, I'd like to thank everyone for attending today's webinar on the AHHQI Home Health Chartbook 2020. As a reminder from the beginning, a replay of this webinar will be made available within the week on the Alliance's website. Should you have any questions about the Chartbook or the Alliance membership or our 2021 research funding cycle, which closes on December 23rd, please do not hesitate to reach out to me via email at jschiller@ahhqi.org. Thank you so much, Heather, and thank you again to our sponsors at NAC. Have a wonderful day, everyone, and please stay healthy and safe. Thank you.
Great. Thank you, everyone.